Yeah, please.
Hi, Matt, thank you.
Okay, we are now live, as they say. Hello to everyone at home. So good afternoon, colleagues, and thank you for your attendance at this Children and Families Overview and Scrutiny panel. We're very fortunate to have an array of dedicated and knowledgeable officers amongst us, both internal and external providers. So I'm sure that we'll have an interesting and informed discussion. Can I ask that before making a contribution, you state your name and job role if you are external to the County Council, just so that we know. I'm not going to do a let's go around and introduce ourselves, but if you could just say who you are and where you're from, that would be really helpful. We haven't got any members of the public here, I don't think, today, so I was going to do a welcome, but I won't do that. It's always a privilege to chair this meeting, and I shall endeavour to take us through the important business of our meeting in a calm and equitable manner, encouraging participation. And as we move through the agenda, I shall briefly introduce the item, then call on the relevant officer to present their paper. Then I'll go to other professionals in the room so that we can hear their perspective, and also the Cabinet members. And then I will open up the floor to take questions, hopefully in the order that I see hands raised, but I might miss them, so just wave at me if I've missed you out. Where possible, responses will be given by officers and people here present, but we should also acknowledge that on occasion they might need to provide a written response, especially if a lot of detail is required. Please remember to try and switch on your microphone before speaking and off when you've finished. And just a reminder that this meeting is being live streamed, as I said at the start. So does that approach work for everybody here? Great, that's brilliant. So let's move on to the agenda because we've got a lot to get through, as we always have in this meeting. So agenda item 1 is apologies and named substitutes. Sam, please.
We've got apologies from Councillor Sam Bastow and no substitutes.
Okay, and also Director Adam Johnson is unable to join us today, but has sent some very eloquent and well-prepared members of staff to report on his behalf. Agenda item 2, declarations of interest or party whip. Do I see any hands on this item? No, fabulous, thank you. Item 3 is public participation, and as I said, we don't have any today. So agenda item 4 is confirmation of the minutes of the previous meeting. So first of all, a thank you to officers producing and circulating the minutes. Does anyone have any points of accuracy they'd like to make, or are we okay to sign them off? Okay, great, I shall sign them now. Okay, thank you for that. So, moving on to the main body of the agenda, so agenda item 5, progress against the SEND Local Area Partnership Priority Action and Improvement Plan. We've got various people that will present on this item with us today, and also both Cabinet members here, welcome. So we've been provided with the latest update on progress made against the plan, and this is a standing item on our agenda following the inspection in April 2024, which had a level 3 outcome. So at a meeting of this panel held in September 2024, it was agreed that the partnership would update this panel on the progress being made against the priority action plan on a quarterly basis. So we had an update at our last meeting, and we've got a second update today. In this meeting, we are being asked to consider the update on progress against the SEND Local Area Partnership Priority Action and Improvement Plan, determine whether we wish to carry out any further scrutiny, and agree whether we would wish to make any comments to the Cabinet member with responsibility for education and SEND. We did have a full and frank discussion about this action plan at the last meeting, so I wonder if we might focus on any points of progress or concern this afternoon, if that's okay with everybody. All right, so that we're not going through everything right from the start like we did last time. Great, so I think it's Daniela presenting on this one. So Daniela is the Assistant Director for All Age Disability. Sorry, I'm doing your job for you. 0 to 25, and she's going to introduce the report and share the progress. Thank you, Daniela.
Yes, that was a good introduction to where we're at and why we're here again today. So I'll pass across to colleagues the various parts of the action plan because there are colleagues here who will give their updates in respect of their services and the partnership overall. We have had a stock take, so we talked, I think last session, that following the level 3 outcome, we have 6 monthly stock take sessions with DFE and NHSE, and then within that, so at 3 monthly interviews from there on, we have 6 monthly deep dives which focus on specific areas. So the 25th of September we had a stock take. Overall was positive. We await the report, so once that we have that will be shared, and I'm sure when we come next time we'll give a bit more update on the feedback from there and what we're doing next. Additionally, we're currently developing our self-evaluation framework, and that is being done as a partnership this year, really focusing on how we're working together, how we've made improvements as a partnership, and what our next steps, progressions forward are. So I'm going to hand over to Jade in respect of Priority Action 1, and then we'll come back to me after.
Thank you and good afternoon. I'm Jade Brooks. I'm the Director of Operations and Delivery at Herefordshire and Worcestershire Integrated Care Board. I am also responsible for Priority Action Plan number 1, and that is in the area of waiting times. Now, at the point of the inspection, quite rightly, there was outrage around both the volume of children and young people waiting and the length of time that they were waiting, particularly to see community paediatrician or to receive an assessment and diagnosis for neurodivergent conditions. Equally, our waiting times in therapies were also found wanting. In terms of this quarterly update, I can confirm that we have progressed what we said we would do, which is to introduce greater capacity for the neurodivergent assessments. This month, 50 families will have been contacted to ask their permission to transfer the role of their assessment to an independent provider who we have accredited and assured with regard to quality. We have also set up detailed monitoring that sits behind that so that we can check the progress of that assessment. In other words, we do not want any unintended consequences of a new waiting list growing somewhere else. What you will see from the report is that the total number of children are and continues to increase. That is no surprise, considering the amount of demand out there. If we were to think of the total number of children, young people with neurodivergence in our county, it could be as much as 5%. Currently, the numbers seeking an assessment and confirmation of a diagnosis is 3 times that amount. So you can see why we're out of kilter in terms of being able to supply a timely assessment service. However, compared to where we were at the time of the inspection, we now know our children really well. We know what they are waiting for and how long they are waiting and any risks associated with their wait. We are committed to eradicating these long waits, but it will take a further 2 years to do that. In part, that's because of the capacity that we can identify and then also the cost associated with it. Although we are a system in deficit, this area is a top priority. So we'll be spending an additional 1.2 million this financial year to support 900 children to get to their assessment stage. So that's in the area of neurodivergent. If I now draw out from the report the impact on therapies, that's a much more pleasing position. So the waiting times for therapies are now restoring. They are good in speech and language therapy. They're getting better in physiotherapy and will totally recover by December. And then with regard to occupational therapy, they will recover by March. And all of those are well understood. It's through both the implementation of something called the balanced system approach, so that's the transformation of how we deliver interventions with children, but it's also actually recognising it is far better to intervene earlier in the life of a child. So we have started to link our therapists to every school, and that's in the hope that if we can offer advice and guidance and work as a single team across education, health and social care, we will be able to support families in a more timely way, rather than the medical model that health follows today. So we do have ambition. In the next quarter, we should be able to report back to you about the impact of those 900 children that are in the process of transferring. As I said, first 50 have started, and every 2 weeks another 50 gets added into that process. We'll also be able to report back on something called waiting list validation. That's when we really have a good clean and tidy up of the waiting list. And then lastly, we'll be able to talk to you about our joint plans as a SEND partnership with regard to new models of care. So moving away from that medical model I mentioned earlier. I'll hand back to Daniela.
Okay, I'm going to move on to Priority Action Area 2. So Priority Action 2 focused on co-production with children and young people. So in April of this year, we employed 2 co-production officers with a specific role and function of building relationships with children and young people within Worcestershire to support their involvement at a strategic but also operational level around change and their involvement with and ensuring their voices were heard within the SEND partnership. So we those 2 co-production officers have been in post now for 6 months, and within that time have been doing lots of work with children and young people, local schools, and the partnership as well in respect of the development of co-production. Most importantly, they've developed a Children and Young People's Forum. That forum has kind of progressed now, and they have designed their own logo and have also named themselves Voices United Forum. We've got leaders from across the service that go to those forums as well to hear those voices of the children and young people, but also answer some of the questions that they put forward there. We've got a co-production webpage, and that's been developed and continues to be added to, so you can access the webpage and it shows examples of co-production we've been involved in, where children and young people have been involved in co-production across the partnership, not just within specific activities or tasks that have been set. We have 17 members signed up to Voices United Forum at this point. We've got a Facebook page that's come from that, so we worked with the children and young people to establish what social media platform they wanted to use, and at the point that the report was written, over 1,000 views within there. We continued to work with kids, and did a piece of work with Kids Charity again about engaging children and young people, ways of doing that, and ensuring that their voice is heard. One vision for children and young people in Worcestershire, so they are currently formulating what that vision is. We're developing training materials for teaching of skills for participation, and that's being delivered, was delivered throughout September to learning services. We've got an increasing number of people joining the forum, and we've held an event at the Hive in August again, which saw attendance from children and young people and their parents from across the county come to see what it was about and begin participating within that. We've got children and young people that are now attending our exec board, again to hear the conversations, to contribute to those, and to take some activities back in their discussions to feed back to Voices United Forum. So we continue to make progress around Priority Action 2, the development of the forum, and kind of the acceleration in that Priority Action 2 has taken place since the implementation of those two officers in April. And we have a plan for the next 6 months of what that looks like, which includes further training and development, ensuring that the children and young people's voices continue to come through from those sessions that are being held into strategic planning, some focus on those that are harder to reach, our EHE and EOTAS communities. We continue to have leaders attend those sessions, that there is visibility of leaders within the Voices United Forum, but also that children and young people are able to ask the questions that are pertinent to them. We're looking at how we integrate the children and young people into our quality assurance programme, so they can be part of our auditing, and from a children and young people's perspective also. So, and then improvement area 2, Sarah.
Hello, thank you. I'm Sarah Wilkins. I'm the Assistant Director for Education, Inclusion, Early Years and Pupil Place Planning for Worcestershire County Council. And I'll briefly summarise improvement area 1 of the overall plan. So in the report, that's paragraphs 28 to 54. So the improvement action areas different to priority action areas under the inspection framework. The improvement action area starts with really an indication for leaders across the partnership to make sure that they're gathering accurate data and using that really effectively in order to make sure that we can see gaps and provision and commission appropriately. Now, I won't cover the health data. Jade has and can talk about the changes in the use of health data in depth and has described some of that in her piece. If I just cover over the two areas that were referred to in the improvement plan, which was about looking and using and tracking attendance data, and particularly Scrutiny panel will have heard before that we agreed with Ofsted that our tracking of attendance for children attending independent settings needed to be strengthened. That has been strengthened across the last academic year, and at the end of the academic year we were seeing a majority of our independent schools returning attendance data. Accompanied with that during the course of last year was some deep dive work into children's experiences who were severely absent from their setting, taking the voice as well of those children and young people. And that's enabled some of our independent settings, and specifically the ones that were with the largest numbers of children and struggling with some aspects of attendance, to alter some of the services that they provide and do more work with children when they were not attending school. Overall, the report will show Scrutiny panel that children across the board with SCN and EHCP's attendance improved across last year, which is a real positive, and we hope to see that, expect to see that continue again for this new academic year. The other aspect of detail within the inspection, and again that's followed through into the improvement plan, was around using data and tracking children attending alternative provision schools, making sure that, as has been a feature in a number of years and is not just a Worcestershire issue, children get stuck in an AP school when with complex needs, and actually they need to move into a specialist provision. So we've continued to work with our AP schools, which is very fortunate to have 7 AP schools, all of good or outstanding Ofsted judgment. And in our analysis and work with those schools this year, the number of children waiting, or the proportions of children waiting in that AP school to move on, has reduced. And so the maximum at the end of last term of any group of children in an AP secondary school was 33%, I think, of children. So not all of our children in AP schools are children that need to be in specialist. What's not detailed in the report, because this report is about a progress to the improvement plan, is the impact, I've covered it briefly in paragraph 45, is the impact of the DFE and NHS England send an AP change programme that Worcestershire is part of. We're part of the regional group for the West Midlands that's made up of Worcestershire, Telford and Wrekin, Shropshire and Herefordshire, which is part of a national programme to pilot, prototype, test and improve different ways of evidence-based programmes helping children and families with SEND to get the right support at the right time. We're really pleased to be part of phase 3 of that, and that means that there's another range of programmes out there in schools, including the primary school initiative to improve neuro-inclusion in those schools. It also means that phase 3 of the AP outreach programme has continued, and we saw in the report details some of the impact that has made to our children and young people. So we've got a further year of that work, which is great, because that has provided direct support for children through the course of last year. The Send an AP Change programme has a series of work streams, but it is governed through the SEND Partnership Committee, and so there is oversight through that board of the impact of that programme. So that's my improvement areas.
Okay, then on to improvement area 2, which focuses on timeliness of EHCPs and quality of plans. So overall across, in respect of timeliness, we've seen the timeliness improve across our 16 and 20-week data. So comparatively, if we look at where we were a year ago, so August of 24, our 16-week data was at 37% completion within that period of time. And since January of this year, bar April, we have stayed above 70% of our children and young people's EHCP decisions made within 16 weeks. And our 20-week data again has improved. So last August we were at 29%, and this August we sit at 77% completed within the 20-week timeframes. And that has been the case where we've been above 60% since March this year. So we're starting to see some consistency in that performance data and that continued improvement within those areas. The service restructured during the summer period, so June, July. And so we have moved to a service which is split pre and post 14 with a focus on pre-14 and into the school and school life, and post 14 really focusing on preparation for adulthood. And so we did expect to see some drop over the summer period in respect of those completion rates as we moved staff and cases around. We didn't see that drop, but we recognised that there were some difficulties with contact. So families being able to communicate directly with their EHCP coordinator. We've continued to address the communication element. It's a cultural shift that we continue to try to make within the service. We know that there's still a lot of work to be done around communication. It's one of the significant points that families continue to raise, but we hope that as we move into and settle into this new model, that the communication routes won't directly be just with EHCP coordinators. We've created access to a team, and subsequently it should help to improve in time some of that communication. With regards to the quality assurance framework, our last deep dive, we had some reassurance from the deep dive that they felt that we had a good, strong foundation to our quality assurance programme. But there were things we wanted to improve on. We already had plans in place to look at the feedback loop, the learning we take, and just how robustly we implement or re-implement any learning from our auditing. So we've undertaken some workshops with parent carers, health colleagues, social care colleagues, and SEND colleagues, and to really look at the journey of a quality assurance programme. What does that mean? How do we ensure that all of the learning we take actually influences change at child level, but also at service level? So that work begun in July, and it has been on hold in August to start imminently again in September. So that is underway. So we have the quality assurance framework in place that will continue to run and function, but we are looking at how we progress that, and just gives us more detail, but also more outcome focused of what does it mean for the service and service change. And then on to improvement area 3.
So improvement area 3 is with regard to the long waiting times at the child and adolescent mental health services. Since the inspection, it looks rather different now, would be a very brief summary. And the report indicates both the improvement in workforce, so they did have a 32% vacancy. In July, it was 11.9%. And then since then, we've got more people coming into post, particularly this month, so it's on its way down. And then in terms of the waiting times, meeting the NHS constitutional standards of a child being seen for their first appointment within 18 weeks, we've moved from 52% to 87%. So both of those starting to demonstrate resolution to what the inspectors found. The other point, though, is that we have used the time equally to make sure that the service model is fit for purpose. We have heard from Health Watch Worcestershire and Parent Carer Forum with regard to their experiences from members of the public with regard to accessing CAMS and the concern they have about being rejected, and they've been able to share case studies with us. So we've just completed an audit into CAMS, looking at the types of cases that are seen, speaking to the clinicians and getting clarity about the cases, for example, that were shared with us. From that work, we've identified some really good practice, but we've also identified some improvements that we'd like to demonstrate, really to make sure that the services are applicable and have a really robust approach to the treatment of children and young people with neurodivergence conditions. The other bit for us at this quarter has been the going live of a new service around emotional well-being called Mellow. It now looks for us in Worcestershire that we have a better offer for our children and young people, covering both emotional well-being all the way through to that specialist child and adolescent mental health services. In the next quarter, we'll be able to elaborate in terms of Mellow's work with children and young people, in terms of the outcomes they've been able to secure. But in the report for this time, you'll see some of the early numbers, and it's very positive in terms of particularly the 59% of children and young people that have made a self-referral into Mellow. So looking at emotional well-being and mental health, we now have Mellow. We have our digital offer, the Luminova, which is very suitable for sort of 7 to 11-year-olds. We have our mental health in schools teams with plans to improve the coverage to more schools. And we have our specialist services doing better. All that means that we have a more robust model. Next quarter, though, we need to ensure that our staff understand that offer and no child falls to the wrong door or between doors, and that we continue to listen to the voices of children and young people and our parents and carers to make sure that offer is what they want and is well taken up.
And they get that's all updated.
Thank you all. I think that was a great example of teamwork there. You handled that really well. And I don't think you could have spoken any more quickly if you'd have tried. And I know there was a lot to get through, so thanks for the comprehensive summary. I think we'll all agree there's some really positive, welcome positive news and progress to report. And you've highlighted some of the areas that I know that the panel want to ask some questions about. Before we move on to questions, Stephen, as Cabinet Member, is there anything you'd like to add specifically in relation to what we've just heard? Thank you.
Yes, there's some good news on SEND improvement metrics, which you've heard about. Whilst there are still long waits for ADHD and autism assessments, our ICB colleagues have plans in place to improve these. You've also heard from Jade Brooks the very significant improvements in CAMS. As regards the timeliness and quality of new EHC plans and the quality of existing plans, there's been significant improvement. I'd like to thank the officers and their staff for bringing about these improvements, while we all appreciate there is much more to do. For my part, after attending the local area partnership SEND stocktake meeting with these colleagues at the ICB on Thursday afternoon, I visited Riverside SEND School in Worcester on Friday morning, where they are achieving good outcomes with a split site. That's 2 locations in what are very cramped conditions. On the Friday afternoon, I visited the 2 very enthusiastic 2 co-production workers and heard about their work since being appointed in April, as Daniela said, 6 months. And I met with the Redditch Parents Carer Forum this morning, a sharing and self-help group, and I've offered to work with them on their many issues raised.
Thank you, Stephen. Some good connections being made there. Okay, on to the panel. I believe someone had a question on Priority Action Plan 1. Anthony, was it you kicking us off? Yep.
Thank you, Chair. Good afternoon, everybody. A question regarding the total number of SEND children, which I've got here from the figure I found a couple of days ago, around about 10,800. I don't know if that's correct or not, or if it's approximate. But I just wondered, what is the breakdown in that figure as regards age groups from the earliest to the eldest children who have SEND needs? And does it give a correlation, as one of your people pointed out, that the younger you identify this, the better the outcome? Would those figures correlate with that, saying that you are identifying them young, and therefore, as you go to the age groups, there are less children in need of SEND as they get older?
I'll start just by clarifying cohorts. I'm not sure where the 10,000 came from. So we've got about 7,800 children with EHCPs, and then there's another cohort of children who have SEND support, so recognised special educational needs, around about 15,000. But there's so we've got a SEND population which isn't just defined by those cohorts. So in respect of waiting times and the cohort overall, I'll come over to Jade, but just so that SEN in Worcestershire is greater than our EHCP cohort of the 7,800.
Thank you. Because the waiting lists have been here for some time, it's difficult to look at that waiting list and assume that we are treating, or at least offering support, advice and guidance and interventions to children in a timely way. We would say we're not, just by virtue of having that waiting list. If I look at the referrals that come in on a month-to-month basis, the majority now are younger children. And that means that in our new models for children and young families, we need to consider having the maximum capacity for the children between the ages of about 5 up to 11, so those primary school age years. And in particular, to have enough capacity that follows the academic year, so that, you know, into August and into September, we have an increase available for the types of increase in referrals that we're going to get. We can see all of that coming through in our data now, which means once we've brought those waiting times down, we should be able to plan services accordingly. You're quite right to point it out.
Thank you, that's all.
Thanks, Jade. I really appreciate your honesty there, actually. But I think Hazel wants to come in, and then I'll go to Matt and then to Dan. Okay.
Hazel Shaw, I'm the co-chair of the Worcestershire Parent Carer Forum. We regularly meet families whose SEND needs aren't picked up until late in their journey, typically where their disabilities are invisible and haven't been spotted along the way. So, yeah, there's a definite difference between if you have an obvious disability and how early that's supported versus if you have an invisible disability. But some families have got kids where they believe their children have special educational needs, and obviously they can't access easily diagnostic services, etc., and they aren't on the SEND register. So, you know, there are families falling between the gaps, I suppose is my point.
Thanks, that's a really helpful insight. Thank you, Hazel. Matt, would you like to ask your question? I should have said before this, though, if you do have a paragraph number or a page number, it might help people, and a name of who you're asking your question to. It might help if we can articulate that, if that's okay, please.
Thank you, Chair. I was all ready to say, because I've got two questions, both on the same paragraph, paragraph 15. So the first one is about the PINS, Partnership for Neurodiversity in Schools, because it mentions 34 primary schools involved in this. So just the question is that going to increase from the 34? We've got plans to, because obviously 34 is quite a small number. So that's the first question around that. And I might as well throw the second question in again, because it's pretty much the next paragraph or so. It's about independent assessors that the right to choose. Once we say, yes, these are good independent assessors, please use them. So it's kind of how do we get the message out there? Because it'd be nothing worse than someone spends money on an independent assessor and then they're not one of these. It's kind of, and then we say, well, we don't actually approve that one. So how do we get that message out? Those are my two questions. Thank you.
Okay, yep. So, Sarah, you want to respond to them both, or just the first one? Okay.
I'll take the first one, and I would also invite Hazel to come in on the PINS just thinking about the future for PINS, because the Parent Carer Forum are integral to the delivery of a successful PINS programme. So the Partnership for Neurodiversity in Schools, trips off the tongue, doesn't it, is an NHS England funded programme that arrived in our area and was launched in Herefordshire in the previous academic year, and we're really pleased to be part of that programme in Worcestershire for starting in this academic year. It is a programme, an evidence-based programme that is designed to be rolled out across primary schools. I think we would be shared, Hazel, in of a view and ambition that the successes of this need to be understood for secondary as soon as possible. This programme is confined, one, by the level of resourcing, and two, by the system's capacity to be able to establish something. Experience would show that if you're starting something new, you're better to start it in a structured way and show the success in solid steps than try and roll out something to everybody immediately. What we have done in Worcestershire is attempted to make sure that we've got coverage across all of the districts. That's really important. I think we've seen a very initial maybe reduction. It requires quite a lot of capacity from the school to get involved. But going back to giving you all of that and then back to the start of the question is, absolutely, we would want to see this roll out. I was at part of the launch event last week. Hazel was attended more of it than I did, and so would be able to give a better indication. But the initial engagement and the launch event where you've got people all together in person, our schools are really very positive about this. They really want to take part. And what we would want to see and really hope that what is a central government programme, it continues to be supported and funded and rolled out, and absolutely needs to be pushed through into the secondary phase, because that's going to be so important. Hazel may want to add to that.
Yeah, thanks for that, Sarah. Hazel, did you want to come in?
Yeah, so I think from the parent-carer point of view, there's tangible enthusiasm for the PINS project. When parents get wind of it, the first question is, which school is my school on the list, kind of thing. So yeah, enthusiasm, and we've got over 100 parents coming to a launch tonight to kick off the project that we're doing online tonight. So I mean, the schools that have signed up for it, let's be straight, they're the enthusiastic schools. So we're desperate to get to some of the other schools that are less enthusiastic to join, and that's where parents would probably like us to be the most. But we've got, we're starting somewhere, it's opening doors for us. And some of the work as funding, we've recently been in receipt of some funding from the Change programme that's going to allow us to extend that PINS type work into some of the other ordinarily available schools that are working on a project at the moment. So in my mind it's called PINS Plus, but we'll see. And we want to create a legacy off the back of this PINS project, because there's no point rolling something out, it lasting a year and that be the end of it. So we're trying, with our Parent Carer Forum hat on, we're trying to develop, with funding from the local authority, develop the Parent Carer Ambassador Network, which is very similar to what PINS was doing. So the timing's beautiful for us. So we're trying to get our foot in the door and build those relationships between the parents and the schools, because we're better off working as a team to support the children rather than the sort of the whole them and us thing that sometimes goes on. So we're having some open, difficult conversations, grasping some nettles, but the schools that are involved seem keen, and we're going to get out across the county in the next couple of months and see how it goes. But yeah, I think
That's great, thank you. It's good to hear that it's been positively received by schools, parents, everybody pretty much who's involved. Matt, you had a second question, I think, didn't you, around independent assessments providers? So who would like to pick that one up? Jade, okay, thanks.
Yes, so in the NHS, and this is true of whether we're talking neurodivergence assessments or if you want to get a view on your hip or your knee, we have this thing called patient choice, or the right to choose is what it's called for mental health type services, of which this falls under. What happens is that you go to your GP and the GP then will show you a list of providers and then support the patient, in this case a child, young person and their family, to select which one out of that list. And you will have seen that the NHS in its 10-year health plan is desiring to make that information available to patients in apps and things like that. Going back to where we are, though, in Worcestershire, we have started to accredit these providers, these independent providers. So they have to meet the same quality standards as we would expect of an NHS provider. There should be no difference. We are now at a stage where in the report, it shows that we have 4 of these providers, and for children, that is a requirement that the assessment must be undertaken face-to-face. And now we feel more confident about communicating that more widely. So already we've reached out to our GPs and our networks in primary care to talk about this. But we will also be offering them some training and awareness sessions so they know exactly the sort of thing to look at and have an informed conversation with probably the parent or carer sat in front of them. We will then also make that information available to families, both through the Send local offer, but also if they approach their GP surgery, we'll make sure it's there and it's in clear language. We're also talking about how we can support families that may need assistance in understanding that patient choice and what it means. So rather than assuming that everyone can find that bit of the local offer, read it and understand what it means, we're thinking about how we can be proactive in informing families. The other bit for us is a tricky one. If we were to do that level of publicity, what would happen is children that have not been in our queues could find themselves getting to the front. So what we are trying to do is look at those that have been waiting the longest, and in the first instance, we'll target our communication to them first. That enables them to jump out of their long queue and take advantage of the shorter queue in the independent sector. As you can imagine, there's a lot of monitoring behind all of this to make sure that happens and it happens safely. But throughout this year to come and into next year, I think you'll see more communication about that, including then out to education, schools and early years settings, because we are finding usually families are talking first to education before they come to health.
Thanks, Jade. I found that really helpful. Did that answer your question, Matt? Hazel, did you want to come on that specific point, and then it's Dan's question?
Yeah, I was just going to say that I attended the attendance conference this morning in Worcester for schools, and one of the, I presume, head teachers or senior leadership team from one of the schools asked about independent reports and did they have to be accepted, and especially where they didn't think they agreed with them. And it took everything within me not to grab the microphone at that point. But the answer is to that question is, as long as they're done to nice standards, then they should be accepted. And the response from the ICB person that was there was, actually, you don't need a diagnosis. You need to meet the child's needs, irrespective of a diagnosis, and that's where the focus should be. And lots of parents meet this sniffiness around independent reports. And I think we need to be focusing on the needs of the child and not second-guessing the quality of the report, which is a polite way of saying people need to stay in their lane, don't they? So, thank you.
No, thank you, and well done for showing some restraint, self-control. Don't know what you want to call it, but okay, Dan, you've got a question.
Thank you, Chair, and apologies for sounding like both a statistician and a teacher as I start to speak here. It's relating to section 12 and 3 to 14, but in particular 12. It's really welcome to hear that there's going to be an increase in investment here where we can actually see there's going to be more assessments. This line graph caused me a tiny bit of frustration because I understand you're saying there's 200 referrals per month that are happening. We've got two lines at the bottom that are as wide as they probably are showing numbers. And at the same time, I can't see how many people are being assessed. And there's three criteria here that are really important that obviously we would want to scrutinise. One is how many people are sitting on the waiting list. Two, how many referrals we're actually seeing. And three, how many people are actually being assessed so we can actually see what's happening and that's coming down. I can more than happily spend some time showing you how to do this so it actually is more visual, but it was something that I found quite frustrating because actually I've got lots of information here saying that things should be happening, but that graph isn't giving me any evidence to say that that is going to happen. So if we could resolve that so at the next meeting we can see that, that would be greatly appreciated.
Jade, are you coming back on that?
I am indeed. So there's a nice piece of work right at this moment in time where what you're actually asking me for is can I demonstrate a commitment to a trajectory and where are we on that trajectory, as well as then show the components of activity that makes up how we're bringing those weights down. So we're just finalising that. These will be documents that will be shared with the SEND partnership, but we can also bring them here either in advance of our next quarterly session in response to today or in the next quarterly pack. But yes, we've done exactly that. And apologies, the graph is clumsy.
That's great. Well done, Dan, for preempting that. So, Debbie, I know you want to come in. I just want to go to Seb first, if that's okay with you. Seb?
Fab, thank you. Yeah, just relating to paragraph 14, just so I can get a better understanding. So we've got 900 children. Is that there are only 900 children that have waited more than 104 weeks, or is that, and then if it's not, Clive, you shaking your head, how do we pick those 900? Is it the longest waiters, or is it the people that, it is, fine, you're nodding, and that's good. And then the only other one is, if a parent declines the third party provider or the independent provider, what happens then? Are they just stuck on this wait list, or are they sort of shimmied up a bit? Could you just go into that a bit more?
Thanks, Jade. There's some very sort of big nods going on, but for the sake of everyone watching at home, because you wouldn't have been on camera, it'd be great if you could verbally answer. Thank you.
Yes, certainly. So at the end of March, 31st of March of this year, we took that as our snapshot date, and we looked at all the children that were waiting, what they were waiting for, and how long they had been waiting. Then we were able to secure, as I say in the report, the 1.2 million. And then we've gone out to our providers to say we want to buy as much as we can buy for that quantum. And what we looked at in the level of need goes back to Hazel's point about treat the need rather than the diagnosis. And we've done the same in the waiting list work, is that we looked at how many children there were that were waiting over 2 years. And we have prioritised those for the 900 slots. I have to be honest with you, if I can find any more money, I'll keep going above the 900. And indeed, we anticipate that some of those families that are on an NHS waiting list have probably already got a diagnosis. So we will see some children come off the list in addition to those 900, but we'll keep going until we've spent every pound. Now, the cohort, as I said, is as at the 31st of March. Already since then, there's more children that have tipped into waiting over 2 years. They're my next cohort, and we will go down systematically, making that offer to families to go and have their assessment done elsewhere. In response to your question about families that say, no, thank you, I feel uncertain about this, I've waited so long, I might as well stay with the NHS provider. They are also then taking those individuals and booking them in to be assessed in the NHS. But there is a limiting factor there. They have very small amount of capacity, so the wait will be prolonged for those families. But that's a family's choice. When at the end of this year, we will go back to those families and have a more in-depth conversation about what was the reason that made you stay. And it could be, for some of those families, they are already seeing NHS paediatricians for other reasons, and they just want all the care consolidated in one place. So the other thing that we will be doing alongside the Health and Care Trust is looking at the productivity of those clinics. Can we book another 1 or 2 children on? Can we drive down our do not attend rates, just so we can see the maximum number of children as possible?
Thanks, Jade. Okay, Seb? Yeah, great. So we've also got Debbie Lamont. Sorry, Debbie, I didn't introduce you at the start, from Health Watch, and I think you have a question at this point.
Thank you. It's a question for Jade, actually, just around this transfer of the 900 children. Obviously, within the data, it's saying that the wait list is growing by 250 on average a month. So that would potentially mean 1,500 new referrals are expected during that 6-month period. And obviously, you're transferring 900. So what's the plan to prevent the backlog from growing again, like with regard to additional investment after that 900's used?
Thank you, Debbie. So I think I said earlier, this is a 3-year plan. So it's likely the ICB will support the continued transfer of children into 26, 27 and 27, 28. But Debbie's right to highlight that's not the solution. That's just taking down the numbers of children waiting into something that is going to be the new normal of the demand that we should expect to see every year. This is where our redesign comes in. We are interested in the work of the PINS project that Sarah and Hazel have already mentioned. But we're interested in how we can use primary care in particular to support children to have their diagnosis more locally, and how we use those right to choose or those independent providers as well. We are then going to look at developing a service for children with very complex needs to remain in the NHS and have sufficient capacity so we've got a sustainable offer, i.e. not create a new waiting list there. And then the third component is for some of these children that go on to have medication needs, we need to have a very robust service for those individuals. And we're currently investing in a nurse-led clinics to get that off the ground. So those 3 things should converge together to give us confidence about the ongoing offer for the Worcestershire families.
Thanks for that response. We've had so many brilliant questions, and we're only on about page 5. And I'm enjoying the dialogue a lot. So I think I'm going to give an extra sort of maybe 10, 15 minutes to this item if we need it. If not, we'll move on. And I appreciate, Sarah, you do need to go at some point. But we're only on, we're about to start action 2, I think. So does anybody have any questions sort of going forward in the paper from here? Mel.
It's just basically touching back onto PINS. I was just looking at the fact on the Milo plan as well, and the Voice United. So I'm just wondering, why can you not sort of bring them together and introduce them to each school at the same time too? So I feel that the plan itself, it's actually working. So ideally, if it needs to be sort of introduced to all schools, so that you can actually recognise these sort of conditions and symptoms quickly.
Okay, any response to that, Sarah?
I think I would say that we all recognise the how positive PINS has started and the potential for it. Hazel rightly pointed out some real opportunities for Worcestershire, that with the existing work that the Parent Carer Forum have done with some schools outside of the programme to develop the parent ambassador model, that's an opportunity for further developing relationships between schools and parents to improve their better understanding and teamwork to meet children's needs. And then the PINS programme does bring in for the school additional training, awareness, but the success of PINS is about a sort of cultural shift and leadership. The work of Voices United and the young people, again, it's a very, very positive start. And actually, a lot of our schools where children are attending do very well to engage their children's voice as well. So there's things to be built on. The ability to accelerate that is complicated, one by resource, and that's about availability to fund training, to fund staff time to do it. But it's about capacity, and actually what you will win from schools who get on board with this programme and progress. There is nothing as powerful as the experience of one school to another, and the experience of the parent, the development of a parent partnership, a parent care ambassador to other parents. And so it will build in that way. It kind of builds the foundations. Like I said, and I want to say I've been around long enough. I've seen how you try and roll programs out. If you do try and do everything with everybody, you will. Some schools are just not in a place to do that because they've got other issues. What you do is you build on it. What I think Hazel's point was earlier, and we would stress again, is what we want, and we work with the DFE and NHS England on this, is for it to continue and to continue to grow, because it's a national programme. So yes, if we could wave the magic wand, yes, you'd have all schools at a point where they were engaged and had the resource and capacity. But we will build, we will construct in a sustainable way. Thanks,
Sarah. I would like us to move us on, if we can, onto action point 2, which is around the co-production element, which we've heard, a lot of really positive things about the progress being made there. And I know I went to the Hive event myself, and I met the co-production workers and chatted with some of the young people and their parents and carers, and I was really impressed, actually. But is there anything that you haven't mentioned already, Hazel, that you wanted to sort of share with us about the people you represent's feelings about the co-production element so far?
In terms of co-production with parent carers, the adults, we're getting our foot in the door in lots of places. I think I've said this before, we're definitely more involved than we've ever been. And I feel like we're being heard, but we need it to translate into actual deliverables for families. So, and we've had honest conversations about this. It's not going to be mended overnight. So I can see lots of activity, and it needs to translate into actual differences and outcomes and deliverables for families, and that hasn't hit the ground yet. But are we involved? Yes. Are we part of the conversation? Yes. Is everybody listening to us? Yes. But the realities for families, not there yet.
Great, that's a really positive start, I think, and you're right, the hardest conversations are the ones that you have at the start, aren't they, and hope that they would continue to try and solve some of the issues, but sounds like a great partnership. Who's got a question on the co-production element? Anthony, you have? Yep.
Thank you, Chair. I have a long question. I don't know who is maybe best to answer this. I can possibly break it down into about 4 or 5 elements, so I'm sorry for putting this on anybody over there, but firstly, as regards the actual co-production officers, at what stage do they get involved with the children? It's been put to me that it's children up to 25 years of age when you read it on the website. So at what stage do they get involved? Is it during or after the assessment?
It's not related to the stages or phases of the assessment at all. It's about children and young people with SEN, with EHCPs. They could have siblings with an SEN. It's about giving them the opportunities to influence and change. So it's not, there's no correlation between SEN journey and their involvement within the Children and Young People's Forum. It's something that they can become part of at any point in that journey.
Thanks. Second part of the question. What sort of information are these co-production officers actually gathering from the children, and how do they use it? How is it correlated? How is it fed back into the system?
So there's a number of parts that they're working on. So the first is about vision. What's the vision for children and young people in Worcestershire? What's their fundamentals? What do they want strategic leaders to understand about, for children and young people within Worcestershire? They're also working on outcomes. What outcomes are important for children and young people in Worcestershire? So what outcomes do they feel that strategically, as a service, as a partnership, we should be delivering to? So they have begun that. So we have some ideas around what that looks like for them, and they're currently in that full formulation stage of the outcomes that are important for them, so that we can begin to really focus on actually being led by child journey and impact on for children and young people, and measuring against those rather than the kind of areas that we've been set before and we work to as our kind of service plans and partnership plans.
Okay, thanks. I don't understand your meaning on this, but you say about asking them on what they want as a journey. How do you approach your 3, 4, 5, 6-year-old with that question?
Many different ways. So the co-production workers are working with children and young people who are non-verbal, pre-verbal, communicate via other means. They're not just vocal in their communication. They're done through communication boards. They're done through what is important to me, what things in my family are important to me. So actually looking at those common themes across a whole spectrum of children and young people's needs for a variety of communication methods.
Okay, thanks. Last but one question on this then. Is there any involvement with the parents on this journey with the co-production officers, or is it purely between the co-production officer and the child? Does it get fed back to the caseworker? How do you correlate all this information and produce sort of events out of it? If you understand what I'm trying to say, it seems what's the end goal of all this?
For children and young people, there isn't an end. It's a continuation of their journey, their experiences, them being experts in their experience of childhood through their journey in school. What does it look like for them? What do they want to see change? Positives and negatives of that journey, and continuing to feed into an ever-changing, evolving system. So there isn't an end point. With regards, the co-production officers are currently focusing on their work with children and young people and the development of that forum and ensuring we have a place and space for those opportunities, and the parent carer forum are sharing the voice of the parent carers within Worcestershire. We have parent carers that support their children and young people to attend the forum as well, and any feedback there, again, we have a closure loop, so any questions, queries, any specific case examples or anything that comes from those, they come back to myself and or caseworkers, and we then resolve any of those issues and respond to those as a separate entity, because the focus of the forum is about themes, change, progress, not about individual child level issues of plans, etc. This is about service development and contributing to what the service and partnership looks like longer term.
Okay, Anthony, I'm going to come in here just because I know you've got one more question, but I wonder if you could take the conversation offline, if that's okay, because I'm conscious that I know Dan has a question, and also we've run over on time. And so after Dan, I'm going to take probably 2 more questions on the entire paper, I'm afraid, and then we're going to have to move on. Otherwise, we're in severe danger of running over. And I know other people have places to go. So Dan, would you like to ask your question?
Thank you. I know this was an area where we had particular issues, and having sat on this panel for 4 years on and off, I remember that co-production was a particular area, and I'm sorry, Hazel, I'm putting you on the spot here. One of the issues we really had was that there was a general lack of trust, and I know that is a word that we still kind of probably are tentatively moving towards, but I would just like to ask that, as somebody who probably also 4 years ago did not feel that I could trust the process, are you beginning to feel that parents are beginning to trust it, that they are beginning to feel there is the potential that this could work? Basically what I'm asking is, are parents beginning to feel like that they might actually reach that end goal that you were saying just then about actually feeling like there will be measurable outcomes that come from the co-production?
Some parents, we do get the odd bit of feedback now to say that they've had as an example, we had a couple in recently from parents who've had good EHCP experiences, so they were expecting the worst, and it wasn't, and I've shared that feedback directly with the team. There is a long way to go to build trust, and trust doesn't turn around overnight, and people have long memories, and you know, if you have a good recent experience, it doesn't negate all the previous nightmares and troubles you've had. So is trust returned? No. Has it got the potential to return? Yes, I think we're taking steps in the right direction, but like I say, it hasn't all translated into new realities for lots of parents. We still meet children that haven't got a school to go to. We still meet children that haven't got a diagnosis, etc. Is lots of activity taking place to try and get that to the right place? Absolutely, I see it all, but it's got to hit the ground for families and before it translates into their reality, which allows them to build trust. Does that answer your question?
It really does, because I think sometimes there's this idea that basically, obviously we know we're on a journey, but I think sometimes we do need to kind of know that raw, gravelly reality, because otherwise we are going to be in a situation where we could end up where we were before. So thank you, because it is one of those where I know it's quite a difficult one to answer.
Great, thank you. Seb, you have a question, and then I'll have time for one more if you want to indicate.
Yeah, of course. I think this is about the ICB as a whole. I think last time we met, it was quite evident that there were some financial strains at the moment. I just want to make sure, especially with the service mentioned, sort of paragraph 80, that the funds are ring-fenced and secure going forward, that we're not going to meet in a quarter and we say, actually, the financial position's changed and we have to scrap. Because I think all of us agree that it's, things are improving, things are getting better, and we don't want to see that scrapped because of budgets, but we know we live in a budget-driven world at the moment.
I'd absolutely agree with your sentiment. So those services in paragraph 80, they are commissioned for the next 3 years. So we won't be touching their finances for that element. And also the commitment the ICB has made around children and young people being a priority, that's not going to change. You know, we have, and you can see it in the paper in response to the questions today, we have work in progress. We're not about to down tools on this area at all. And to the point that, you know, I'll be starting the round for 26-27 monies, you know, and I will be seeking a similar level of investment again. To be very blunt, we have to. There are children and young people at the heart of this, and they're still waiting. So we've got to, you know, we'll continue to work on eradication of that. But no, at this point in time, they're not the type of budgets that the ICB would dip into or alter.
Thank you. I'm sure we will find that reassuring. As you've said, it's a tumultuous landscape out there financially and with budgets. But so that was a really interesting Q&A session. I'm sorry it seems to have flown by, but I really appreciated the openness and honesty with the responses and the excellent questions that we had. And don't worry, this paper will come back to us at one of our very near future meetings. So I hope you don't mind if I move us on. We haven't unfortunately managed to get quite to the end of it, but thank you all for your contributions. And just while we have a changeover, Superintendent, are you coming to sit at the front? Or yeah? Would you like to come and sit in the front row? Okay, we'll give people a minute to do what they need to, and then we'll move on to agenda item 6. Yeah, close the gaps. Brilliant. Oh, okay. Well, yeah, we all know about people who sit in the back row. It's fine. All right, that's great. I think we're ready to move on to agenda item 6, which is the Worcestershire Safeguarding Children Partnership Review for the year ending March 2025. This is a scheduled annual update, and we're being asked to consider the information provided within this report, note the progress of the work of the partnership, and determine whether any further information or scrutiny on a particular topic is required. So I'm going to hand over to Superintendent Gareth Moore, who's the chair of the Worcestershire Safeguarding Children Executive Group. I hope I've got that right, to take us through the report. Okay, Gareth, you all right with mics?
I think so. Thank you very much. Good afternoon, everybody. So I'm here today to provide the summary of the Worcestershire Safeguarding Children's Partnership Annual Report, covering the period April 2024 to March 25. The amendments made by the Children's Social Act 2017 and the Children's Act 2004 strengthen the already important relationships by placing duties on the police, integrated care boards and the local authority as statutory safeguarding partners. Safeguarding partners are under a duty to make arrangements to work together and with other partners locally, including education providers and childcare settings, to safeguard and promote the welfare of all children within their area. This includes our appointment recently of an independent scrutineer, Rachel Egan. Her role is to drive continuous improvement and provide assurance that arrangements are working effectively for children, families and practitioners. This report sets out how the three safeguarding partners within Worcestershire, the Council, the Integrated Care Board and Westmercia Police, have worked together to safeguard and promote the welfare of children. The partnership report is made publicly available through the publication on the partnership website, and I've just presented the report to the lead safeguarding panel. This transparency, including the presentation of the report today, are crucial in providing reassurance to our communities, parents and children that we have their best interests at heart. The past year has been one of significant transformation. The updated Working Together to Safeguard Children statutory guidance, which was published in December 23, required us, to review and adapt our local arrangements. These changes were delivered on time by December 2024 and are now embedded in the way that we operate. National reports from the Children's Safeguarding Practice Review Panel also shaped our priorities, particularly around interfamilial sexual abuse, race and racism in safeguarding, children with disabilities and serious safeguarding incidents. Within the reporting period, we've carried out work against a number of different priorities. Firstly, Get Safe, which is Worcester's name for our multi-agency support and protection for children and young people at risk of exploitation. The Get Safe strategic group paused in late 2024 to realign its priorities, but an operational group continued to coordinate frontline response to exploitation, ensuring no loss of safeguarding delivery. The realigned focus of Get Safe will look to understand and respond to serious youth violence and violence outside the home. This has been a significant focus of the Joint Targeted Area Inspections, known as JTI nationally, as too many children are carrying weapons because they feel unsafe and see this as a form of protection. Serious youth violence has a wide impact across communities, and a failure to consistently identify serious violence as a safeguarding issue is leaving too many children at risk of serious harm. That is why we have realigned our focus on this area. Secondly, our Quality Assurance Practice and Procedures Group, their role is to support the improvement and development of services in Worcestershire by delivering multi-agency programmes of quality assurance through focusing on three key areas, those being audits, service user feedback and key performance indicators. This group led the response to the Alfie Steele Child Safeguarding Practice Review, developing and monitoring a robust action plan, issuing targeted learning briefings, embedded new practice standards around issues such as confirmation bias, physical abuse and child protection medicals. They also oversaw the local implementation of the Working Together 2023 reforms, strengthening links with schools and the voluntary sector. Thirdly, our Child Safeguarding Practice Review Group oversees the management of rapid review processes and the commissioning of child safeguarding practice reviews within Worcestershire, and is responsible for ensuring that child safeguarding practice reviews are completed to a high standard and within the agreed timescales, and that any recommendations and learning resulting from these are fully implemented. The group have embedded learning through the Keep Me Safe programmes, for example, on infant crying and reducing head trauma, and developing a new resource on dog safety. They have provided system-wide training and conducted audits across health providers and thematic reviews focusing on parenting capacity, mental health and engagement with our Gypsy, Roma and traveller families. The group have commissioned an independent review to undertake a comprehensive analysis of safeguarding activity between September 2019 and December 2024. The final report will be completed during this year, and with the findings from that will provide improvements to the way that we safeguard practice, continued focus on preventing harm and improving outcomes for Worcester's families and children. So we're waiting on the outcome of that report. Finally, it's important to recognise the significant contribution and place that the Education Head Teachers Safeguarding Steering Group has in our meetings. Schools remain key partners, and as such, the group consists of representatives of Worcestershire's phases of educational settings, providing quality assurance in the safeguarding work of the education sector across Worcestershire, and importantly, a direct link for that work into the wider safeguarding partnership. The group improved threshold decisions at family front door, with referrals from schools showing stronger alignment to safeguarding levels than other agencies. They have also strengthened responses to bullying and peer-on-peer harm, enhancing online safety provision, and ensuring every school participated in safeguarding audit. When we talk around funding, the partnership continues to be jointly funded by the Council, the NHS and West Mercia Police, with contributions rising in line with inflation. Business support, Operation Encompass and Family Front Door remain key funded priorities. In summary, the partnership have continued to strengthen safeguarding arrangements, respond to national learning and embed reforms locally. There has been clear progress, but the report is candid that more needs to be done to ensure learning is consistently embedded across agencies and that we can evidence the real impact on children and families. As such, our priorities for this reporting year are, as an executive group, we are committed to improving how we identify and respond to domestic abuse affecting children. We recognise children as victims in their own right and aim to strengthen professional awareness and targeted support. We will embed the new strategic focus on serious youth violence, and we will also support partners to understand the changes to the Children's Wellbeing Bill and develop these into enhanced local practice. As you said, Chair, the panel today is asked to note the progress made by Worcestershire Safeguarding Children's Partnership, consider the annual report, and decide whether any particular areas of safeguarding require further scrutiny. Thank you.
Thank you. I'm not sure what to call you. Do I call you Superintendent Morgan or? Well,
Chair, you can call me what you want.
oh, dangerous. No, thank you. That's great, Superintendent Morgan. I think thank you on behalf of all of us for the annual review and the report, and for particularly for being here in person to answer, our questions from the panel. But before I take those questions, I'd like to go to Justin as Cabinet Member for any thoughts or comments that you'd like to make in relation to the report.
It's just a very comprehensive report, and certainly aligns with what I've seen so far, that things are improving. There's still work to be done. We just want to keep things going in that right direction. So, but certainly the increase in youth violence and the increase in risk of serious harm, I think it's right that that's a focus, particularly with some of the recent cases we've seen. So,
that's great, thank you. So, who on the panel would like to kick us off? Matt, please.
I'll kick you off. Kick us off. It's mainly around kind of questions around the online side of things, because I think that's a big area. It's focused on page 15, talks about within Get Safe, about focus on online. Just so wondering how you kind of tackle things like we've got the rise of far right, we've got the rise of people like Andrew Tate, Tommy Robinson, all these influencers out there. So Andrew Tate promoting kind of misogyny, which we saw a lot in the TV programme Adolescence. But it's how do we go about tackling those kind of aspects first? Thank you.
Thanks, Matt.
Thank you. I think with regards to this, it's the strength of the partnership in that we've expanded beyond our statutory responsibilities into education, etc., and the voluntary sector. And I think with regards to the Get Safe partnership and as we move into that serious youth violence, it's by working with and educating those organisations so that they can highlight the children that they believe are at risk through conversations, through what they recognise, through incidents that might be reported to them. And as such, then there is a gateway into Get Safe, where then key professionals from across the organisation, voluntary networks, are then enabled to come in and directly have conversations with the child or children and or parents in order to educate and hopefully move away from that activity. It's not lost on probably all of us here that the world is in a very strange place at the moment, and that things moving on to an online platform and the speed of social media, us as a species are not designed to keep up with the the speed off it are they. So I think my only add to the great work that's being done and that recognition, that education and that pull away from a multi-agency point of view is that we need to continue and are continuing to develop our approaches in this area in order to move with those specific times. And also, you know, I'm a father of a 13-year-old girl. She will mention social media platforms that I've never heard of. And, you know, there are ways, and it's only through that continued engagement across the different agencies, working with those specialisms within Get Safe, I think that we're able to hopefully intervene at the most appropriate forum. Sorry, I'm moving away from that. At that appropriate level. The Get Safe itself has a number of different levels of interaction and intervention, as you can imagine, ranging from those that are proportionate with regards to the scale of what they see. But I think it's incumbent on us just to ensure that we move at that pace. But Get Safe is a success. We were talking as a partnership with regards to making that BAU across the partnership, and however, noticing that the change, as you quite rightly say, with regards to the influences and that dynamics and the change with serious youth violence, that's why we've retained it and added a continued focus or changed focus on their priorities. Hopefully that goes some way to answer.
Yeah, can I just come back, because just as a paragraph within your report where it talks about the online side of things and you Get Safe strategic group, but it says the partnership has not yet been able to progress specific actions in response to feedback from children and young people regarding online safety. However, it's an emerging priority. So can I just explain why that actions have not been taken, or what you're waiting for? Thank you.
This, when it was written, there was a pause where we looked at the terms of reference with regards to the strategic group. The operational group, however, has continued to run underneath that. From some of that feedback has helped us reaffirm those priorities for the Get Safe group with regards to that serious youth violence and those rising issues with regards to knife crime, etc., that we're seeing nationally, but also on our own unfortunate doorstep. So.
Yeah, thanks for that honest response. And thanks for raising that, Matt, because I'm sure many of us did watch Adolescents and were impacted on what we saw there. So, Dan, moving on to you next, I think. You have a question?
Thank you, Chair. Just of a similar vein, I'm actually a trustee of a youth centre, as well as all the other hats we all seem to have these days. One of the things that I've been very struck by, thankfully, is the honesty of our young people actually talking about their kind of perceived concerns about kind of knife crime and also kind of threats of violence. And obviously the Section 8 about the kind of Get Safe strategic group and this side of it, it was a little bit, not concerning, but more is trying to square the circle of you've got these young people in these youth centres. I know that the police do come in to actually talk to them regularly, but actually as a resident, I know parents as well, they will feel kind of that we don't necessarily have the same understanding of what possibly could happen and what is happening. I know we do have the Get Safe strategy and I know it is out there, but how can we actually make it clearer to parents and residents kind of what is happening? Because I think sometimes when I talk to residents, they say, well, no, this is all happening, it's really scary. And actually, it's really hard to get that across to people that actually there is a lot of action going on behind the scenes, and actually there's a lot of dialogue, but it's not necessarily happening, if that makes sense. So I know it's quite a difficult one. I know this stuff happening, how exactly do we get that out to people? Because at the moment it's just not there.
Sure, yeah. Gareth, any thoughts? Emma. Oh, Emma, sorry.
Hello, no, Emma Brissain. I'm one of the assistant directors in children's social care, but also oversee some of the Get Safe activity within children's social care. Just to answer your question, we do a lot of out in the community outreach work. So part of that is absolutely making sure that we train our multi-agency workforce, and that is led by the PCC, who also fund that, and the Get Safe team are also part of that training. So one of the advantages for us is to have a wider reach through the workforce of those workforces that are in the youth hubs, those places and spaces where young people and their families go, our education colleagues, making sure that as a workforce we have that understanding and that knowledge, and the central point of information sharing is where we've got the multi-agency partners that meet every single week. Certainly over the summer holidays and through our campaign, we've been, I think for Get Safe, it's been a success, and it's been well embedded for 6 years. So we're out in communities, we go into colleges, we go into youth spaces and places on a regular basis. So lots of the engagement, you're right, are absolutely with young people, and young people will talk to you when you're in their spaces. If you do a questionnaire, we get a very poor response, but if we go out and talk face to face with young people, we get a lot of rich intelligence from young people. Sometimes reaching parents is harder because understanding technology is a challenge for lots of us. The apps are changing on a daily basis. How young people are, it's an ever-changing form of harm and abuse for children and young people. And what we see is that the way perpetrators target young people changes. So we have to keep learning and reflecting and listening to the voices of children and young people to understand that. I think the messages are around, if you've got concerns about what's going on in your community environment, think about where you need to report that. Is that something you need to report into the police, your neighbourhood police? Is that something you need to report within your school environment? And I think it's about knowing where to go to share concerns that might not be specifically about your child, but might be about activity that you know is going on in places and spaces where children and young people, that will get fed into the Get Safe operational group, who do look at how do we go in and do disruption activity and target particular places to try and understand what's going on, or share information about partnerships and come up with a strategic response of how we're going to tackle maybe some activity that's going on within those areas. Often we're learning very much from our young people and those trusted relationships that we build with young people. We have a range of Get Safe workers who go out and work directly with children, and also I know across the different district councils, they've got outreach and detached outreach workers that also do fantastic work with young people. So a lot of that intelligence is fed back into our weekly Get Safe meeting, and then the operational group will look at, actually as a strategic partnership, what do we need to do and come together to tackle what we're starting to see as an emerging challenge or an issue within those spaces.
Thanks, Emma. Okay, Dan? Have a think.
Still, the thing is, I know all of this is going on, and this, because I've sat through this before and I've gone, this is amazing. I still don't quite understand like how we then get that out to residents, because residents have got the same concerns, but actually we do need to find a way to do that. But I think that's more of a ethereal question at this point, rather than we can fix it right now.
Yeah, I think it's a good point, well made. I'm sure we'll be able to discuss it at another meeting. Oh, Gareth, you want to come in?
It is a good point, well made. From a police perspective, there's often a fine line between celebrating success and saying what's out there and scaring everybody as to what is happening. However, you are right, we need to educate, we need to celebrate that success, we need to highlight what can be done. The knowing where to go, your question is a good point, and probably one of the first one to consider, albeit I think Emma's touched on some of that, is within the partnership and the links they've got into the community and the outreach workers, is educating them on what the signs are and what to pick up, because they're engaging with a wider audience than any of us will be. And then from there, knowing the referral mechanisms, they can pick that up, educate, and ensure that referrals are done. So the point you raised is absolutely a good one, probably one from a branding issue with regards to Get Safe and where that goes and what it is. So it might just hit somebody that sees it, they go on that's all it is. They go on the website, they have a look, they then start to educate themselves, they then see some behaviour, they then know where to go and report it, and that's the bit, isn't it? Closing that circle. Thank you.
No, thank you. I think it was worth exploring that a bit further. Okay, Anthony, you had something you wanted to say?
Thank you. Yeah, I think I understand your problem as a police. In my short time as a councillor, I was involved in an incident in Kidderminster a few weeks ago, where a 7-year-old child had apparently been bullied by a bunch of youths, 13, 14, 15, I'm not too sure. The parents seemed more concerned with putting it on Facebook than actually reporting it to the police. You know, on a community page, you know, it was, you know, my son, my grandchild had been abused, had been bullied by these kids. Well, you know, I did get the police involved and say, you know, well, you really need to talk to the police about this if it's an issue, if you have a child that's been bullied. And then somebody else piped up and said, yeah, we actually have footage of these children, these youths who had apparently done the bullying. And I said, well, can you send it to me or send it to the liaison officer at the police? And, you know, we'll get something done. And they couldn't be bothered to send the footage. You know, so I appreciate what, you know, the situations are in the towns and the cities, and really I don't understand what the answer is, because if people are more concerned about telling the street their child has been bullied than actually going to the police, where do you go from there?
Yeah, you're right. I think the only way is people like yourself and other people that are educated in this and have some sense of moral dignity, that they are then trying to realign that moral compass and trying to have that underlying safeguarding aspect and drive that agenda, as opposed to the parents' agenda of likes and stuff.
Yeah, point taken. Justin, question?
So I just needed to just make a simple point, if I may, at the risk of being slightly controversial. Just over 15 years ago now, I was involved in Chelmsford Wood, de-radicalising young men from the influences of the EDL, who were rampant at that time, and actually we were very successful in that area. It is incumbent on politicians at a local level to be part of the solution here. It doesn't help when we hold up TV dramas like Adolescence as if they are factual. It was a complete work of fiction. And the reason I can be clear on that, and I was actually invited onto GMB TV to talk about it, but unfortunately I couldn't make it. There's never been a case like that in Adolescence, and actually the reason it was a work of fiction was because there were none of the other risk factors which were involved. So we've got to be very careful, because we scare parents, and it's really about this point of we've got to make sure that the information we are giving out is good information, clear information, highlighting what the real risks are, and equally what the real solutions are, which is work like this. Yeah. So I just wanted to make that point. We've just got to be a little bit careful about how we talk about things.
I can't comment on whether it was purely fictional, whether it was based in reality. I did think it was, because I think that the producer had done some quite deep research around the characters. But anyway, that's perhaps another argument. I think, none of us want to sensationalise anything, but we do need to be mindful that these programmes, these issues are out there in society, and so we can't ignore them. But, we do need to be mindful about how we explain what's going on to people to try not to escalate matters. But I do think we need to acknowledge that there are threats out there in society to all of us, adults, children, young people, and we can't shy away from that. But thanks for making your point. I've got a question, if that's okay, unless anyone else wants to come on. I am the chair, yeah. So it was actually, I've written it down because it was something that I'm quite passionate about, is domestic violence. And I just wondered what your partnership or relationship was with the family courts in terms of safeguarding, or if there is one, or if there needs to be one developed. Just because domestic abuse survivors and support workers had told Women's Aid that they've continued to disbelieve children, the family courts have disbelieved children, and they've been forced into unsafe contact situations with perhaps perpetrators' parents by the family court. So I just wondered, is there a relationship there? Is it something that's being monitored, or can it be?
Shall I answer that one for you? Certainly the family courts, you're talking about private law applications there, which is different to what children's social care would be getting involved in ordinarily, because that would be private law proceedings, and that would be private applications between parents regarding contact or residency of their children. Certainly, I can't comment, and I don't think it would be appropriate for us to comment really on what's the relationship between judgments that a court of law makes in relation to those contacts and what information was put before them. So I think certainly we would always advocate where we've identified that there is a risk to any victim of domestic abuse or any or any child or young person that was experiencing domestic abuse would be we would want to make sure they've got access to the right support, the right protection, and that we would be either signposting to the relevant support services or the relevant agencies, or we would be involved in supporting that family ourselves.
Thanks. You highlighted what was going to be my supplementary, which is the kind of what's the way in if we suspect that there could be an issue around that. So I'm pleased that you did that without me having to ask. Do we have any more questions on this report before are we happy to move on to the next item? Happy to move on? Okay, thank you very much for those of you that are here specifically for that item. Thanks for coming back, Gareth, to report on that. And we'll move on to agenda item 7, which is the performance and 2025-26 in-year budget monitoring. So I think we're going to take this in 2 parts. Am I right with that? Yeah. So we're going to be hearing from Emma, I think, to introduce the performance element, and then Holly to introduce the finance update. So without further ado, let me just remind us what we're here to determine, whether future information or scrutiny on a particular topic is required, and whether we've got any comments to highlight to the Cabinet members. So with that brief introduction, over to you, Emma. Thank you.
Lovely, thank you. So obviously you've all had an opportunity to look at the papers. So if I just take you through to some of the highlights or some of the areas that you might want to draw your attention to. So this relates to Q1 of children's social care data, and it's Q1 is the 1st of April this year till the 30th of June. So what we're seeing here is, I've highlighted within this report, is we have seen a significant rise in incidences being safeguarding incidences being reported to children's family front door. So when I compare the data last year for the same period as to this year, we could see an extra 452 new referrals into the family front door relating to children and young people. Now, what some of that may relate to, when we start to look at the breakdown of the data, is we can see that when we move to the next graph on the right-hand side, how much of that may be information sharing, where other agencies are involved with children and young people and their families, but are sharing safeguarding concerns with us and making us aware of what's going on in those activities with those families. So working together 2023 enables partner agencies to share safeguarding concerns or worries at all different levels of need with the front door and the local authority, children's social care. So on a positive, despite the significant rise within that quarter of contacts and referrals, we were able to respond to decision making within 24 hours was at 79%. So despite there was a significant rise, we were able to maintain a good response time in terms of making decisions about the safety and welfare of children at 79% of those inquiries. And I've had conversations with partner agencies to understand what we think that might be about and what was that. And colleagues within the police and with health were also seeing a rise in contacts with their services during that period of time. So hence why we would have had some more information about children and young people during that time. That then translated to seeing some increase in children that required a social work assessment and contact with a social worker as a result of those contacts through the front door. And I think there was an increase of, I think it was, I've written it down here somewhere. Was it 48 additional social work assessments during that period, which obviously had an impact. And when I personally became involved with some of those assessments because of the levels of complexity and the levels of this we saw in that period of time, which is generally through the start of the school holidays, some families with some really complex, challenging, difficult situations, and a significant number of child protection inquiries where we issued care proceedings before the courts in relation to children's safety and welfare. So it was a very challenging time within the service during that period of time, and that's reflected in the data set. What I will highlight that we became aware of during that quarter is that West Mercia Police have also got a backlog in referrals that they needed to process and share information with the family front door. That is now in the public domain in relation to they've just recently been inspected by HMIC, and that report and that finding is in the public domain, and we are working in partnership with the police to address some of those safeguarding concerns that they've got and how they're going to share that information with us, and that's ongoing and in action now for the reassurance. In terms of our work, the outcomes of those social work assessments for families, we can see a rise in families where we identified that they needed that early help and that early intervention outcome. So we saw a rise from 17% of the families that we assessed to 20%, which is really positive, that we're making sure that families receive help and support when they need that. And therefore, it was starting to demonstrate a reduction in families that needed to go on and have a social work service thereafter. When we look at looked after children data, we can see that we continue to have what we refer to as a healthy heartbeat of children who are being prevented from coming into care and children who are unable to go home. So those numbers are staying relatively static and stable within those, even though we've got children that are coming in and we've got children that are going out of care during that period. We've also, on a positive, we're really pleased that we're starting to see a reduction in children who are 16 or 17 who are not in education, employment or training, because that was one of the areas that we were very much wanting to target and make an improvement in. And we've also got a really good 77% of children were in the same placement for 2 years plus, which is something that we wanted to make sure our matching and our appropriate placement of children and the stability of children in our care was really, really positive. Certainly for the majority of our looked after children, we know that 70% of those children reside in foster care arrangements, which is private, which are our independent fostering associates. And there's a piece of work that I'm sure, I don't know if Councillor Bowen would like to speak about, which is in relation to joint work around what are we doing in Worcestershire around our fostering, improvements to increase our number of in-house foster carers, our Worcestershire families who are foster carers for our Worcestershire children. As in the report, we highlight that our health assessment performance continues to be an area of concern, and these are our health assessments for our looked after children. And a pilot was launched in the summer, and we hope to be able to see by Q2 what's the impact and what's the difference that's made for our children and young people in relation to the completion of their health assessments. Moving through the report, we know that we've got some challenges with the police and we're in dialogues around our child protection strategy discussions, and we've seen a reduction in those joint child protection inquiries from 19% to 16%, and we're wanting to work with the police on around addressing what is that about and how can we improve that. And there's a real focus on how we are joint working in our multi-agency child protection team and the development of that process to look at how we come together as multidisciplinary services at that point where a concern about a child's safety and welfare has been identified through the family front door, that joint sharing of information, that joint response and that joint interim safety plan for that child and that young person is put into place. So absolutely, we've got a commitment from West Mercia Police to work with us alongside that. We're really positive that we've just recruited an educational safeguarding lead who will be working within that multi-agency child protection team, who will also be part of the educational outcomes for children and young people and looking at their education and what their educational needs are to make sure that those are being met within that environment as well. And our continued relationship with the safeguarding health team will also be part of that relationship. So hoping to see, the development of that service is really positive and an increase in those joint investigations and information sharing. We've seen on a positive, we've seen outcomes for children, the child protection inquiries, less needing to go on child protection plans, so a slight reduction in the period from 35 to 33%. But what we're seeing is that those children are getting an appropriate response and they're getting the right service at the right time, and we are trying to work with them in a preventative lens as opposed to statutory wherever safe to do so. Majority of our children on child protection plans are on for between 6 and 12 months, which shows that we're preventing drift and delay for those children and young people. And we've talked previously in Scrutiny around our supporting families first approach, which is our response to children in need, which is our multidisciplinary team that works intensively with lots of different practitioners from different backgrounds, working with the whole family to support them and to address some of the challenges and concerns they're facing, to enable them to be able to move on without the need for statutory intervention with children and young people. And we can see within this report that 76% of those families that we work with in that period, we were able to close without the need of ongoing social work intervention or for them to become looked after or subject to a child protection plan. So really, really positive outcomes for those families that we've been working with during that period. During the summer period, we saw a rise in children missing from home and care. The children that we see are the greatest cohort of children that go missing from home are the ones that are at home within their family unit. And the analysis around, we did some deep dives to look at who are those children, why are they going missing. And a lot of that was children don't see themselves as they're missing, their mobile phone battery's gone down, they're out with their friends, they're out with their peers, they're having a good time, and the parents are reporting them as missing because their parents can't get in contact with them, which is totally appropriate as a parent to do. But actually the child and the young person doesn't see themselves as being missing or not available from home. So often, I think the warmer weather, the lighter nights, activities in the community that were going on, we saw there was not a particular pattern as to why particular cohorts of children were missing from home or care from that data set for that period of time. So a lot of that was around the beautiful weather, lighter nights, school holidays, back with my friends, and actually there was less risk and concern than we were concerned. We went looking to see, have we got a pattern of activities that are going on in the community that are a danger to our children and our young people. That's what we wanted to understand from that data set because it was such a significant rise. And then lastly is our workforce and our quality of our practice. And I know certainly the report from Gareth Morgan shared some of the activity that's fed back through the Safeguarding Board in terms of how we quality assure our practice. But certainly you can see from our data set that our strength in our workforce and the stability and the permanency of our workforce is really, really strong in Worcestershire. And we're really proud to achieve that, but also that means that families get consistency, the same worker working with them, and we are a stronger workforce, and the quality of the practice and the service that we can deliver to families enables us to be able to do that with a permanent workforce. So I've sort of whistled through some of those areas, but I'm more than happy to take any questions.
Thanks, Emma. We do appreciate the report and for you being here to answer any questions that we've got. And just a heads up, Mel, I'm going to come to you first, but not until after we've heard Justin, because I think you might want to update on some of the areas in the report.
Thank you, Chair. I can't update as much as I'd like to because we are in a pre-election period for a forthcoming by-election. So I can't lay out all my plans, much as I'd love to today. What I can, I think, give you is a brief overview of my findings in terms of some of the problems. So some of the problems in terms of why we don't have sufficient placements. Obviously, my focus has been on the fostering side, and although in Worcestershire as a county as a whole, there are a lot of foster carers, unfortunately, they're not with the county council. A lot of them are with, we've got some, not enough. The rest are with independent fostering agencies. The main reasons for that are the independent fostering agencies pay more, they support better, and their recruitment processes are slicker. So when I'm able to give you my plan, which will sort of be after the end of next month, it will set out how we're going to address those, but it will be very comprehensive, and I cannot wait to tell you about it because it's a, you know, I think it's a really good response to that problem. Okay.
Thank you. We look forward to that, Justin. So Mel, would you like to ask your question?
Might help. Might just help. Page 81. It's looking at the children missing education. Can we have a little bit more emphasis on what actually happens? I know that you've sort of mentioned regarding, you know, that they're on summer holidays and so on. But the thing is, you've collected some data. Ideally, if we can explain a little bit more in depth of that particular data, because obviously it's a concern when children are missing, especially when you're looking at the years stretching across. The increase is quite a lot. Thank you.
Apologies, is that the children missing education data set, sorry, in the pack?
Yes, page 81, children missing education. Yes.
it's a different set of data, the children missing from home, which is what Emma was talking about. So children missing from education, so we have established processes around the review of those children missing education. We are looking at individual level, what is the reason and rationale for any children that are missing from education, what are the next steps for them. That CME cohort are all children and young people, so 83,000 school-aged children within Worcestershire, and it's within those cohorts. And children are missing for a variety of reasons. So specifically, the numbers will differ across age ranges for different reasons. So what was the age group you were particularly interested in, sorry?
I'm more interested in the secondary schools because obviously we have to look at their future at the same time too, just in order for us to actually understand where are they and why are they missing school. Thank you.
So children from missing education, they will all have an individual plan. So we have our children that cannot attend school panel. And so we understand individually what's happening for those young people, what their plan is, who they're engaging with, what the multi-agency response is. So we could do give you some further analysis about that cohort, the secondary cohort, specifically if that's our next meet, if that's helpful.
Yeah, thanks for that response. Dan?
Yeah, just on the NEAT data, page 89 in particular, found myself kind of really drilling down into this one, especially after comments that were made last Thursday. Is it possible to get a bit of a trend analysis done on some of the reasons why people are NEET? Because I was quite stunned by the fact it was actually 61% are seeking employment, education or training, because from what was said last Thursday, the implication was it was because everyone was ill. And that number only appears to be 20%. So it'd be really nice just to see that kind of trend over time, just to see if there is any kind of patterns that are there. Because I was especially struck by the point that there's a decrease in the provision of employment training opportunities due to many things, including the European Social Fund programmes kind of being removed. So there seems to be a lot here that I would actually like to know a lot more about, because it does seem to be that actually what we could be dealing with is people are actually seeking that employment, education and training, but it's not actually there, which has kind of got my interest piqued.
Daniela, is that one for you to respond to? We can definitely do it. Can you put your mic on, please?
We can look into the data again across the piece about the NEET cohort and those trends and what that looks like.
Sure. I can help a little bit, I think. This is my previous vocational area was as a connections advisor, so I was fully immersed in NEETs. But there is a small task and finish group that Justin set up as part of Corporate Parenting Board as well, looking at particularly care experience young people and NEETs. And I'm involved in the sort of a deep dive in the NEET strategy and looking at why it's not working for some young people. There is an acknowledgement, I think Judy Gibbs would say there's an acknowledgement it doesn't work for everybody. It's a hot topic, isn't it? We heard from government just yesterday that any young people who are going to be NEET for 18 months are going to be offered, or I don't know if that's the right word or not, paid employment. So I don't know. I've been in that situation before, I think, and I'm not sure it was that successful. So that's one to watch. But the NEET issue, you've raised some really important points. You know, there is a lack of funding, especially for things like roll-on, roll-off programmes and short courses. So it's one to keep an eye on, and one we may need to bring back to this or other committees, I think. But thanks, Daniela. Matt.
Just coming back to the social work report, because it'd be good to have you do the report on the education side of things. But in the social care one, firstly, just to comment about, it's very difficult to look at the data because the graphs just shows the first quarter. It doesn't really show much else, some kind of dotted lines. So it's very difficult to get trends or anything like that. So that would be helpful within the social work side of things. And you kind of answered my question, which was about those children missing from care, because it was like, the comment was, well, it's just nice sunny weather, so they all suddenly disappear. And it was like, that seemed a bit odd. But if they're only missing for a few hours or whatever, that kind of makes sense. I mean, do we have those kind of timescales? I mean, you know, I was thinking of children missing for like days on end, and that, where are they? But if it's just they've gone out for the evening and didn't tell their parents, bit more reassuring. Thank you.
Emma?
No, absolutely. Children missing, every child that's reported missing from home or care has a welfare return interview. So that is carried out by members of the Get Safe team. We've got children's missing officers, and they will engage with the child and will engage with the parent to understand why were you missing, how long were you missing, where were you, what were you doing, and talk to them about the risks and the vulnerabilities of adults and safer adults or trusted adults not knowing where you are and who you might be, and some of the risks, the wider contextual safeguarding risks that we have for children and young people. And that's where we get our rich data in terms of understanding what was the vulnerability and the risk of that child, and what were some of the push and pull factors. And we do analysis around their age groups, how long they were missing for. Lots and lots of our children and young people have just not returned home after the curfew time when the parents were expecting them to return home on a positive. We do occasionally have children who have gone missing and have stayed out overnight. If a child goes missing for 24 hours, we instigate our child protection procedures and work with the police and partner agencies around how are we going to identify with this child, what actions are being taken, is there going to be social media campaigns to try and find this child, and engage the parents in what they'll consent to. So certainly for most children and young people, they get distracted, they're enjoying themselves, they're having a fabulous time with their friends and their young people, and they forget about their battery, their phone and their parents, unfortunately. But we check and have a welfare return and offer a welfare return home interview for every single child so that we can have those trusted conversations and also seek from their parents some of the challenges they might be experiencing setting boundaries or having teenagers listen to them, to offer that support and that intervention at the earliest opportunity, because we don't want children to be missing from home and care on any occasion really. It's useful advice that we're trying to give through those processes.
Yeah, thanks, Emma. I think we picked up on things like crime being reported through Facebook. I've lost count over the summer of the amount of times I've seen this young person is missing from this area, and it always worries me a little bit when I see that on social media, because obviously that's highlighting that young person as being at risk, really. So are those types of things you would pick up on as well, those kind of Facebook posts about missing from Droitwich? And yeah, it's...
Often, yes, we do. Obviously, our communications team will pick up things. Certainly, the police will pick up things. We've got an out-of-hours service. Our emergency duty team are available 24/7. So when the office is closed, we've got a 24-hour service. Children's social care is never shut. So certainly, and neither are the police. So there is always ongoing dialogues and conversations. And families phone us and they share those concerns. And some families will absolutely put those things out at the earliest opportunity. And I totally understand as to why you'd want to do that. And obviously, yeah, I think it's worrying whenever you see a child and nobody knows where that child is. It is worrying for everybody.
That's great, thank you. Does anyone have any questions on this before we move on to the finance report? Or are we okay to move on? That's Matt, yes?
Because we didn't actually have the presentation on the education side of things, I have got a few questions about NEETs and things, because we went straight to social care.
Oh, did we miss part of the report out?
I think Daniela didn't do her little bit on...
Sarah's not here, it was Sarah for education.
Right, okay. I can just ask my questions and then... And you can see,
do you want to ask and see how we get on? And if not, I'm sure Sarah will be happy to answer it.
Quick fire, I've got there's about 3 of them, so, you know. First one is about part-time timetables. So it was just, there was 20% of EHCP children greater than half a year on a part-time timetable. So how do we reduce that? Because part-time timetable, obviously it says in the report, the idea is supposed to be quite short, sort it out, and then get them back. So how do we sort those ones out? That's the first question.
So there's a number of things. So for some children and young people, part-time timetable is the right thing for them at that point in their educational journey. It should always be, or we always like it to be, that period of intervention rather than remaining as is. So where we are moving to is a better understanding of the children and people that are on part-time timetables. So ensuring that they are identified early, the rationale agreed, that it's the right thing for that child at that point in time, and therefore that the implementation of section F in their plan fits with and is able to be met within that part-time provision, and anything that isn't, that we are additionally adding to that outside of their core hours in school. Every part-time part-time timetable should have an exit plan. Where are we trying to get to, and what are we trying to achieve in these smaller periods of time to give the child the ability to feel safe, engaged, supported in school or wherever that provision is, to then get them to a point where they can access full-time. I would say that we are moving to a better understanding, that cohort. So one of the things we know before was we weren't consistently able to talk about who we've got on part-time timetables and why they're on them. So we can identify them better. And we're also able now to talk about the plans that are in place for those young people. So what's the destination? And so we can have elaborate EHCPs with lots of provision in, but if the child or young person is unable to access a provision for the hours of the day that are required to meet that section F, they're incompatible. So what's the interim measures we need to take?
Yeah, thank you for that. I mean, it's an interesting example just from a resident who was kind of, their child was kind of in the kind of just not able to go to school at all. Now they've recently got an EHCP and got a kind of better plan working, and they are struggling, but they're actually going, and it's on a part-time. So hopefully the idea is there is that exit strategy to get out of it. So that's great. Next one, jumping on to elective home education. I think the graph shows there's quite a large rise in that. So just a why is it particular? I know it's been rising quite a lot, but why in particular has it gone up?
So we want to understand the why. So we've got Kate Turner, who's doing an in-depth deep dive into our EHE cohort, understanding the reasons for going into EHE, what does that mean for the family, where did that choice come from, where's that rooted. There is a national increase in EHE uptake as well, so understanding our trends against national trends also. And at CWOP, we're also looking at a deep dive into EHE reasons, where we're at, why we're progressing and seeing this trend. So we note there's a trend, and actually we're now trying to understand that in greater depth what that's about. So maybe as we move forward and we get the outcomes of that, we'll be able to report that back into our EHE data at our next quarterly update.
Can I just commit? What did you at quack?
You're going to have to the definition of CWOP.
Sorry, I don't know what it is.
Quality assurance, practice and procedures.
There you go.
Thank you.
I'd have got my P's wrong.
You got another question, Matt?
In fact, I have my last one, which is kind of connected to the NEETs. So just looking at all the various data, and it was just kind of slightly depressing, but just seeing there was kind of well over 100, if you added together all the ones that are NEETs for over a year, you know, it was over 100. I mean, there was a very small number who are like 4 or 5 years. So it's how do we engage with that cohort? I mean, maybe that stuff that the government's talking about, that kind of hardcore, but sometimes very much government approach tends to be, you know, force you into doing something because, you know, that's the only way. We want to be trying to help people so you don't have to, you know, the carrot and stick approach. Prefer the carrot, if you like carrots. So how do we help those kind of long-term needs?
So I think the NEET strategy is aimed essentially at that. So we know there's a rising number of children or young people that are NEET, but nationally there's also a cohort of young people that are not entering the workforce or continuing education in any way. Judy Gibbs has undertaken a significant piece of work into understanding this cohort of young people and what can we do differently. And that's part of the strategy. That's also part of the task force that's been set up to develop that. And then within SEND services, we're also looking at what does it mean to be NEET within the HCP? What's next for those young people? How do we get them back into employment, educational training? So, and joining up the work that of SEND and Judy Gibbs' team and ensuring that the two link together so that you are supported through a journey into adulthood where it's been less successful. So I think potentially we need to look at Judy's update on the NEET strategy and where it's at now.
Yeah, I think that's a good idea. Is that okay for now, Matt? Okay, well done in Sarah's absence, Daniela. That's great. Okay, so we'll move on to the financial focus now. Do you want to stay where you are, Holly, or come to the front row? It's up to you. Stay there? Okay, go for it.
Hello, my name is Holly Hancox and I am the Senior Finance Business Partner for Children's Services, which includes schools. The budget pack that I'm going to go through with you today is going to start with the overall council position, and then we'll dive a little bit more into the areas that this panel is covering. So I'm going to draw your attention first to the table that's on slide 4 of the finance monitoring pack. And this is the overall Q1 forecast, the financial position for the whole council for 25-26. on the face of it, you look at this table and you look at that bottom line and you think net WCC variance 0, brilliant. Jobs are good and we're all fine. But I just want to take a little bit of time to talk you through this table and make sure that we're understanding the makeup of that and why it looks like that, and whether that's sustainable or not is another question. On this table, you'll see there's one of the top subtotal line is the WC services excluding DSG. Now, what that's showing is that within our services, within our directorates, we're forecasting at the end of P3, so at the end of June, an overspend in the year of 10.7 million. 7.9 million of that is in relation to adult services, and that third line down, children's services, we're reporting a £4.3 million overspend within children's. Now, there are some areas of mitigation, some underspends across some of the directorates that are offsetting that a little bit, and we're able to offset some of these overspends within the services by some underspends within our corporated items. And then we did have within the budget, we had budgeted for a use of £15 million worth of reserves. Because of that level, we're not using all of that £15 million of reserves. But it's important to note that we are still having to use some reserves to get to that net variance position of 0. And that is also a budget that is propped up by the use of exceptional financial support to the tune of £33 million. So once you've used your reserves, they're gone. So that's not to set a budget with the use of reserves on top of exceptional financial support it gives you a sense of the scale of the financial challenge that we're currently experiencing. Those forecasted overspends in adults and within children's services, much the same as last year. These are the areas that are demand-led. There's a statutory duty that we have to perform, and once people meet that threshold for support, we deliver it. We can't. There are things that we can do to try and understand where the demand is coming from and to try and mitigate for those, but ultimately, these areas are those demand-led areas that we're aware of and we're keeping an eye on. Our directors are looking at ways, as I said, to mitigate some of these risks of high spend areas. So I'm just going to now look at the savings programme that we had built into the budget for 25-26. On this next slide, you can see that we had built in savings of 12.5 million across the whole of the council. And 5.6 million of those savings were offered up from the children's services. This graph here kind of goes through where we track these savings quite heavily to see how we are, whether we are delivering the savings that we have proposed and how on track we are, and so we can identify at the earliest possible opportunity where we think those savings are unlikely to be met, again, so that we can decide on how else we mitigate for those. Within children's, in this graph, just to give you a bit of an indication of how we're measuring these savings. The dark green column, your achieved column, that's where we have already, whether it's reducing the service, reducing staff, or we can evidence that we have achieved savings and they're already, that figure's not going to go down, it can only go up. Within children's, a lot of our savings are within, there are some social care related savings, where we don't currently have any in the green on track, and where we would have savings in that column was if we had a planned move for a young person that hadn't yet been actioned. So we knew it was going to happen, but it hasn't yet taken place. So if there's a step down from agency residential to another form of care, for example. What we do have is we have a list of potential savings where we have identified children or young people that are on our potential list to whether that's a step down in provision, whether it's returning home to parents, whether it's being, no longer being a looked after child for a number of different reasons. And we have some mechanisms on how we, again, calculate what the potential impact of those children are. We do have some non-delivery of savings. This figure is a little bit skewed because we have a large number of potential savings that's offsetting some of our savings that are currently non-deliverable, which is largely around the review of Vale Lodge, which is currently has 3 children and young people residing there, and the full year impact of some savings that weren't fully delivered last year. So we're making good tracks and good progress in trying to, again, mitigate some of the savings that we're not able to realise fully this year by further identifying where we can improve some of our savings in other areas. Earlier on the other slide, we talked about the use of reserves to kind of get us to that net zero position in our financial reporting. And this table on the next slide shows you where we're anticipating our reserve balances to be at the end of this financial year. The reasons why we have these reserve balances is largely for funding that is earmarked for specific purposes that can't be used for anything else. We have grant reserves to hold grant funding that is, again, allocated to us for a specific reason. And it's our risk reserve that is what we can use to help mitigate where we've got overspends. And you'll see at the current reporting position that we're anticipating that risk reserve will be 13 million at the end of this financial year. If you think we'd budgeted for the use of £50 million of reserves this year, we wouldn't be able to do that again next year because we're anticipating there would only be 13 million left in that risk reserve. Going on to the next slide, there's talking about the things that are particularly high risk from a financial perspective. The dedicated schools grant is top of my list, certainly. We're conscious that there is this isn't a localised Worcestershire issue, it is a national issue, and what I'm in particular talking about is the accumulated deficit on the high needs block of the dedicated schools grant, which is the part of the dedicated school grant which is funding where children and young people have additional needs that need to be supported. It's that area of the dedicated schools grant that we are considerably overspending on. There is a slide further down in the pack which I think illustrates this a little bit better because it's in a table format and that suits me, it makes it a bit easier to understand, but I will talk you through a little bit here. As it stands at the end of P3, we are forecasting an overspend on the high needs block of the dedicated schools grant of 86.2 million. That is an over 101% overspend on the budget for that area. To give you a little bit of context, and I think this is a useful statistic to root you into what that means on a child level basis. Although the high needs block is largely used to fund the additional support that children need within the HCP, that is not its exclusive use. There is some areas where we are supporting children that are missing education for other reasons. But if as at the end of August, I'm just going to consult here because I wrote it down. As at the end of August, we had 7,646 EHCPs in Worcestershire. The high needs budget for 25-26, if you break that down if you divide the total budget for high needs by the amount of EHCPs we have in Worcestershire, that's a cost of just over £11,000 per child and young person with an EHCP. What we're spending is an average of £22,500 per child. When we break that down, the budget essentially, that £11,000, just over £11,000 per child, that's roughly equal to a band 3. on the scale of the top-up that's associated with those EHCPs, and what we're actually spending. Again, on average, this isn't, you know, I wouldn't say this is an average spend in the, I don't think there's ever such a thing in the world of SEND. But that £22,000 is roughly equivalent to an E4, the top band. We know there are children that have needs and costs that far exceed that £22,000, but I think it just kind of helps to understand that budget broken down and the size of the overspend on what that equates to kind of on a per child basis. I think that's useful. At the moment, there is a statutory instrument which allows us to, that deficit that we are carrying and accumulating doesn't affect the overall council's position currently. That was due to end at the end of this financial year, at the end of March 2026, but that has been extended now for another 2 years. So that statutory instrument that allows us to sit that deficit as a negative balance on our reserves has been extended till the end of March 2028, and we are awaiting government decision and what their strategy is on how to deal with that after that effect. I'm going to move on to capital. So the current value of the capital programme is 495 million. What that means for our capital programme for 25-26 is that it totals 177 million, and of that we spent 24 million at the end of quarter one. The next slide shows you a breakdown of the areas that capital programme is broken down into, and you can see the third line down is the children and families section of the capital programme. There is a decision that is going to be required to be made by the full council at the beginning of November to consider reductions in borrowing relating to our capital programme, and the decision that needs to be made is around about £30 million of reduction in borrowing. There's a slide here that shows you the areas of what that is, but for the purposes of this scrutiny panel, just to draw your attention to the education and social care projects. So that's a reduction in borrowing of around £3 million, and the projects that relates to. It's a reduction in borrowing, so it's reducing the budget for those areas. £2 million of those are relation to £1 million is about improving accessibility for SEND in mainstream schools, and the other is around post-16 additional specialist provision. The other £1 million is around social care projects. There is still where we are in terms of that programme of work. It's around understanding the feasibility and what is possible. So it's not this particular specific projects that are being taken out. It's just a reduction in what's possible, I suppose. I'm going to now take a bit more of a deeper dive into the children's forecast and what that looks like. So as you saw right at the very start, at the end of P3, we were forecasting a £4.3 million overspend within children's. The table on slide 12 of your pack kind of breaks that down into the service areas within children's and also home to school transport as well. If I start with the all-age disability section, so there's about £1 million overspend there. The large majority of that overspend is in relation to Vale Lodge, which was one of is a saving that we are saying is not achievable within this year, and that remains to be ongoing and reviewed, the relation to Vale Lodge. The other element of that, so that's about £780,000 of the overspend is in relation to Vale Lodge, and the rest is largely within the staffing area of all age disability, and in particular educational psychologists and the need for associate spend in that area. The other large section of the overspend within children's is in relation to social care. and at the point of this reporting, that was largely broken down to about £1 million worth of overspend on staffing in through care due to the use of the need for the use of agency staff, and then also an overspend on the cost of social care placements, which I'll go on and talk a little bit more about now. So at the end of June, our placement numbers within social care were 1,048, which is an increase of 13 since the end of March 2025. There is a slight error on this slide I do need to apologise for, that it says that comparing placement numbers in June 2025 with June 2024 demonstrates an increase of 1%, but I'm afraid that should read decrease of 1%. External placements, however, have increased, and that is a genuine increase there. So what we're kind of seeing there is a change in the mix, the placement mix. So although year for year, the overall placement numbers have dropped, the number of external placements and the percentage of external placements that's making up that mix has actually increased, and that is where we're seeing the associated rise in cost as well. So the main issue for placements is the increase in the average cost unit. So we were anticipating an increase in the unit cost associated with social care placements, largely driven by the rise in national minimum living wage and the increase in employers' national insurance contributions as well. But also the social care market and it being a demand-driven market. There's cost associations with that as well. The next graph, apologies, it's again very condensed. We've spoken a lot about the usefulness of graphs in this panel, and I think this probably highlights that issue as well, in that you've got a very large graph and all the numbers are within a very small scale within that graph. But what the purpose of this and why we show you this is our forecast within our social care costs is made up of an assumption on the trends that we anticipate going forward. So what this graph is showing you is that by the end of March 2026, we are anticipating that we will have potentially higher numbers in our social care cohort, and in particular a rise in the agency residential line of that placement mix as well. Just again to contextualise that rise and what it means with the increase in costs. So at the end of June, the numbers of children placed in agency residential had increased to 165 from 162. Within that same time frame, the average unit cost of agency residential had increased from £6,563 a week to £6,964 a week. And that means those additional 3 children that have come into agency residential care would cost around £1.1 million extra in social care with a full year impact. Price inflation alone is forecast to cost the council £3.4 million just for those 165 children, assuming no changes to current prices. And that is not what we've built more growth into the forecast on the basis that we are also anticipating the average weekly unit cost to be rising as well. I'm going to touch briefly on home to school transport. So they are forecasting a net underspend of around £1 million following a review of contracts and routes. The budget was significantly, again, last year we saw a considerable overspend within home to school transport. And in recognition of that, we had built in an additional £10.6 million worth of budget into the home to school transport area. And they've also expecting that savings that were offered of £2.65 million will be fully delivered as well. We've talked about the increase in the number of EHCPs within Worcestershire, and that kind of directly impacts on the home to school transport. Although it isn't just children with EHCP that home to school transport are providing functionality for, logistic support for, it does make a difference. And then the final slide is again just looking at that graph, the table of the dedicated schools grant. So what this table is showing you again is you've got we'd accumulated in previous years a deficit of 98.2 million that we've brought forward. We're anticipating that this year our high needs deficit we will overspend by 86.3 million. And that means we'll have an accumulated deficit at the end of March of 184.4 million. Based on a trajectory of an increase in 20% increase in spend for the following year, that would bring our accumulated deficit at the end of March 2027 to over £300 million. I talked earlier about this being a national issue, and it is a national issue, but in terms of the level of increase, we are near the front of the pack in terms of the rise and how that is increasing. That is the end of my finance budget pack, and I'm very happy to answer any questions.
Thank you, Holly. I think there was a lot of detail and knowledge in that presentation, and thank you for the reports pack as well. I think, if I may, I'd like our lines of inquiry to focus on areas of particular interest to this panel. So I know, Matt, you've got one on DSGs, which is actually in the main part of the pack, but I'll allow that one because it is specific to to what we're here to discuss. So do you want to ask that one?
Okay, yeah, there. Thank you, Chair. I mean, it's possibly more of a political question because we're getting to the point, as you said at the end, the forecast is over 300 million. So, you know, the idea that we've got 300 million lying around, that if they do stop it, we can just, you know, clearly nearly every council will just go bust. So you always get to the point where you go, well, almost ignore it, because they will keep kind of renewing it every couple of years, as has always been the case. So what impact does it have on us by having this massive kind of debt hanging over our heads, other than every other council's got it? So therefore, is it irrelevant, or is that not quite the right?
Yeah,
but
any
yeah,
thoughts
on to
Holly?
that.
Thanks.
I obviously can't comment on anything politically, but what I can talk about is the impact of carrying that deficit. And there is a cost to us. So by carrying that deficit, it reduces our ability to generate our own investment income from our cash balances, and it increases the need for us to use external borrowing for our capital programme. So it does have there is a cost associated with servicing the debt that if we didn't have that deficit and we weren't overspending by that amount of money, it would be additional money that we could. I'm not going to say use for other purposes, because that's not the correct thing, but there is a cost to servicing that debt, and we're having to account for that as well.
Thanks, Holly. Stephen, I know you want to come in, but please can I remind you not to make overtly political points. No point scoring in this meeting, please.
Yes, thank you, Madam Chair. Yes, I'll do my best. I've been very restrained so far. I intend to continue to be so. We're all awaiting the outcome of the white paper on SEND, which I don't think, best of my knowledge, we're not going to hear it in the autumn. I think December is probably the earliest we're going to hear, and it's impossible to speculate on that. As regards to the statutory override, I've mentioned that many times. I mean, to hold a negative figure of 83 million in reserves, I mean, it's a meaningless concept. 300 million, well, what I hear on the grapevine is that Matt is right, that it's most likely to be written off. That doesn't help us greatly, because our reserves are so low, and we're in a very difficult position. Even by writing off that figure, it doesn't leave us well placed. But I think that's what's likely to happen, Matt.
Thanks, Stephen. I do know, because I sit on various LGA panels, that there is a lot of pressure on government to write off the debts, and I know that officers are also putting pressure on government to do it. But it then leads us to the question going forward of funding, you know, to help us out from stopping us getting in the situation again. So let's hope that if they do cancel, it's not a vicious circle. But I appreciate the points you made, Stephen. Thank you very much. Seb, you have a question?
And I'll continue my promise of not being overtly political as ever. I suppose two questions, well, a question and a comment. So I'll do the question. On slide 10, which is page 118 in the pack, we talk about education and social care projects essentially having a £3 million cut. Do we know which projects they are? I think that's quite a large figure to have a throwaway line. And then I'll do perhaps my comment, if the chair allows.
Yes, I mentioned that in... Thank you, Madam Chair. I mentioned that in the Cabinet meeting last week. The two SEND reductions are SEND supporting changes in mainstream schools, and it's just a reduction in the capital programme from 30 million to 28 million, where the outcomes can be met without that £2 million spend. So it's just it's a delivery of the same service. Daniela might want to. No?
Nothing to add, but I don't know.
Yeah.
Anything to add, Holly? Or
yes, just a little bit. So I briefly alluded to it during the presentation, but my understanding is that the reduction in borrowing of those, so as Councillor Foster rightfully said, 2 million is in relation to specialist provision. So 1 million of that is accessibility for SEND in mainstream schools, and the other is post-16 additional specialist provision. The scope of those capital programmes haven't been, they're still in the feasibility stages at the moment, so they haven't been fully scoped out. There's not a specific, we're not talking about a specific provision at a specific school that will no longer happen. It's just the budget that we have available to provide additional provision in those areas. As I said, those programmes of work are very much in the feasibility stage at the moment to see and to scope out what is possible to achieve with the budget that they have available. The other £1 million is on, we have a small capital programme for social care projects. Again, it's a fairly slow-moving programme of work, and so it's not tied again to a specific project. It's just the budget that is available for capital work within the realm of children's social care.
Thank you all. Okay, did you have a supplementary, Seb?
Thank you. I think it's quite surprising, given what we've heard, that anyone would look at perhaps reducing the pool of SEND money, but moving on. On to slide 17, we talk about the number of children requiring transport, but again, it goes back to this key point of, you know, if we're not bussing them out because we're not cutting a school provision, they won't spend as much time, or the number of children won't be the same. So I think, just again, from this panel's point of view, because it hasn't been spoken about here, just that emphasis again on perhaps not scrapping a school and thinking that putting kids on buses is the best thing to do.
Okay, I think that's a point well made that's going to be discussed at another meeting coming up very soon. That's perhaps not for discussion today, unless Stephen wants to.
Yeah, they are. I'm going to the scrutiny panel for corporate and communities on the 20th of October, and then at the cabinet meeting on the 23rd of October, discussing the county hall options. I think you'll hear all about it.
I think we're all welcome to attend that corporate and communities panel if we want to. I'm certainly going along, so that will be where that particular item is discussed.
Yes, as the chair of that, you're all welcome. I look forward to everyone.
You are the chair.
I'm also embargoed, as Justin said, from giving you likely good news, but come along and you'll likely hear good news.
Promises, promises. Okay, so I think unless there are any further questions for Holly on the financial side of things. Thank you very much, Holly. We understand that, you know, challenging times continue, and thank you for all of your efforts. Great, you may leave if you want to. We're going to talk about our forward plan now, or our work plan, but thank you all for your contributions today. I'm in the wrong place now on my screen. That's not helpful. Okay, so agenda item 8 is the work programme. I'm sure you've all had a look at it. You might have noticed a few tweaks. We have consolidated a few items, so kind of put them into a bigger sort of all-encompassing subject area, just to give us room to add our own priorities in, which we've also done. So after the last meeting, you fed us some ideas, and we factored those into the work plan. And also, hopefully, we'll have some space to develop urgent emerging issues, such as any government white papers that might come along, for example. But yeah, are there any comments on the work plan that we need to hear today? Or yes, Matt?
Quick question. In the kind of standing items, the regular stuff, budget scrutiny says November/January. I know we always have it in January. Do we planning anything for November for budget scrutiny?
Sam?
Not aware at this stage anything for November, but I will check with the Chief Financial Officer on that one.
Okay, well noticed. I think also the update we had today around send improvement, obviously that's a quarterly update, and I couldn't see when we were next due to have that on an agenda, but maybe I have missed it because
that as well.
I did scan. I'm just conscious that I don't want to pack too many agenda items into a meeting. We've overrun today because everything has been so important and sort of needs a lot of unpacking and discussion. Yep. So Sam can check that one. Any other comments or suggestions for the work plan, Seb?
Yeah, it's on there, but I would like to explore the AI with the EHCP stuff. I think quite a lot of today's report said that was the time-consuming part, and maybe exploring that a bit further. It is on the TBC, so maybe we could put a date to that.
Yeah, I've got that there. Again, awaiting with bated breath any government decisions on EHCPs, because there has been a rumour that the whole system may be rejigged. So, but yes, worthwhile discussing. AI generally is a big topic at the moment, isn't it, as well? So, okay, anything else?
Are you thinking of adding one more to the November one, or do you think, because obviously we've got 4 on the today we've had 4 things. We've got 3 at the moment.
I think it's because we consolidated the health and well-being with several separate updates, and I think we've made them into one big meaty agenda item. So probably not. It'll be nice to finish on time one day, wouldn't it, with these meetings? And we do get through an awful lot because there's a lot of important stuff to discuss. But probably not, Matt. No, we'll leave that one as it is. Okay. You love long meetings. You had one this morning. Okay, anything else? It started yesterday?
No, it started
No. Okay. Well, you know, my door's always open. If you've got suggestions that come up in between now and the next meeting, you know, let me know, and I can pass them on to Sam and Alison. But I think that brings us to the end of the meeting. Thank you very much. Our next meeting is the 27th of November at 10 a.m. And once again, we'll be here in Witch Haven. Enjoy the rest of your day.